Now I'd like to introduce the leader of our first session, Esther Myers. She's a planning committee member who is the facilitator for this first session, and her experiences began in the Air Force for 25 years, which culminated in serving as the chief consultant to the U.S. Air Force Surgeon General. She provided support in the formation of the Nutritional Evidence Library for the USDA and was the chief science officer for the Academy of Nutrition and Dietetics. She also served for 6 years on the Standing Committee on Military Nutrition Research here at the National Academies, which advised the Surgeon General of the Army on the conduct of nutrition research and related issues. In all of her work, Esther has been an advocate for the role of dietitians in health promotion and the use of quality improvement methodology. Please welcome Dr. Myers.
Thank you, Bernadette. So the first session this morning is really looking at defining the measurement methods, the prevalence, and the overweight and obesity in the armed forces. This session will really set the stage for the rest of the day in terms of laying out the landscape about the trends and magnitudes of the effects of obesity and recruitment on retention, resilience and readiness, and the effects on the military families. We have 5 wonderful speakers today. To lead the session, we have, all the bios are in your notebooks as well. So to lead the session off, we have Dr. Carl Friedel. Of course, I'm used to calling him Colonel Friedel from the days when he was chairing or working with the Military Committee of Nutrition. Dr. Carl Friedel is the chief physiologist at the Army, at the U.S. Army Research Institute of Environmental Medicine, or USAREM as we fondly call it. And he'll be setting the stage talking about how we measure obesity and what is the DoD standards for how we look at military members. Dr. Tracy Smith is going to be our second speaker. She's going to tell us how that works in recruitment. I mean, when we recruit military members in, what's the impact of obesity and overweight? Followed by Dr. Jay Haney, who's at the physiologist at the Naval Research Center, is going to be talking about retention, what happens when we keep our military members. Dr. Bruce Jones will be the chief of the Injury Prevention Division of the Army Public Health Center, and is going to be sharing with us how that impacts on resilience, deployment, and readiness. And then finally, Karen Hawkins will be talking with us from the Office of Military Family Readiness and Policy, the Military Community and Family Policy, and Office of Secretary of Defense, talking about how that impacts the military family members in support of the military members.